Hey everybody, this is Dr. Adam Rennie. This is episode 4 of One Thing. Memory loss, dementia, Alzheimer's, one of the biggest issues right now in healthcare. Today we get an expert's opinion about how to approach early detection and prevention of memory loss, dementia, and Alzheimer's disease, and what to do if you're starting to show changes in your memory. Welcome everybody. This is Dr. Adam Rennie. I am your host of One Thing, where our premise is that change happens with information and inspiration. About today's guest, Dr. Kabran Chapek is a clinician at the Almonds Clinic in Bellevue, Washington. He is a Bastyr University graduate. I've known him for about 15 years when we were student clinicians together at Bastyr University. He's one of my favorite people. He has the perfect combination of intelligence and sensitivity that it takes to be an astute clinician. He's great with patients, has an outstanding bedside manner, and he really has a great mastery on neurologic and brain problems. He has a ton of experience working in this field. Listen in as we dive deeply into dementia and Alzheimer's. At the end of the show, I'll recap with some thoughts. Please share this episode freely on your social media platforms. We're really interested in getting this information out there because it's helpful and useful and can help make the difference in people's lives. Thank you for tuning in today. All right. Dr. Chapek, welcome to the show. It's great to speak with you today.
Oh, Adam, thanks. It's my pleasure to be here.
Yeah. You've always been one of my favorite people. I'm really excited to talk with you. It was great catching up with you for a few moments before we went on the air. I think we should sort of jump in and start talking. Why don't you bring us up to speed as to your current clinical focus and how your career led you to where you're at right now?
Well, sure. Yes, I love that you're doing this podcast too, by the way. This is a really great venture, and it's always good to talk to you too. Just the short version is after graduation, I worked for about 6 years in a partial hospital program, working intensely with eating disorders. Partial hospital is kind of like a residential treatment center, and eating disorders, depression, anxiety, chemical dependency, really integrative team of people. I learned a ton, became the medical director there, and was there for about 6 years. And that's where I got my training, my trial by fire in psychiatry and mental health. And then I started working at Amen Clinics for about the past 6-7 years, doing assessments, helping people with all sorts of issues, from depression to anxiety to brain injury to ADD, and also dementia and Alzheimer's.
Okay, great. And so your clinic is located in the Bellevue area, correct?
Yep, we're in Bellevue, Washington, and there's, I believe, 8 or 9 clinics across the country, but we're the Bellevue hub. Okay,
and do you see patients through telemedicine or in person? What's the setup?
Yeah, I mostly, well, it's about half and half almost now, believe it or not. All in-person visits, of course, are in person here at the clinic, and then I'll do phone or Zoom, which is video conferencing, after that. But then I also do consults for the various psychiatrists in our network of clinics across the country who may need some additional help or expertise with their patients. And we'll do workup via lab, and then I'll, without having met them, we'll actually do video or phone calls and sending
Wonderful.
reports. Yeah.
That's great. So we were talking about some of the areas that you focus on, and I thought today you have so many interesting areas that you work with. I thought today we'd dive in to talk about memory loss, dementia, because it's such a prevalent issue right now.
And one of the things that's confusing to most people is when to be concerned about memory loss.
Mm-hmm.
Sometimes, there's a lot of just gentle like ribbing and joking that goes along with, people who are forgetful or
Mm-hmm.
maybe not as sharp as they used to be.
Mm-hmm.
But what's the line that
Mm-hmm.
we need to be concerned about?
It's a great question because, 1 in 2 people is going to have some form of dementia by age 85. 1 in 2. It's like half of us. And it's staggering. There's like a tidal wave of people, baby boomers are getting older. There's a huge amount of people that are going to have some form of dementia, if not Alzheimer's, as they get older. And it's happening earlier and earlier. When pretty much every other chronic disease has gone down. HIV is quite treatable now, and it's more of a chronic disease versus a death sentence. Cancer, many, not all types of cancer, but some types of cancer are very treatable. Breast cancers, sometimes. Whereas Alzheimer's and dementia, the rates continue to go up with no solutions in sight. And so that's, and the current approach is that it's sort of the head in the sand. If you don't, it's better to not know, just kind of live your life. God forbid that if you get Alzheimer's dementia, there's nothing we can do. There's, put your things in order. We'll see you in 6 months, maybe give you some Aricept or Namenda. I think that's unconscionable, that there isn't support now for folks when it's like your brain. This is who you're going to lose who you are. I've just told you. So I think a lot of clinicians feel like they don't want to screen people. Kind of back to your question, like they don't want to screen people because they know they don't have a lot of options for them. And people don't want to be screened because if, like you said, there's a lot of joking. Hey, you're just getting old. It's just a senior moment. So
Right.
how do you know when a senior moment should be worked up? And what I'm always thinking about, it's either one of two things. On the one hand, it's either, maybe it's normal aging. On the other hand, maybe it's the beginning of a neurodegenerative process that's going to end up as Alzheimer's or dementia. Do we want to take that chance? No, we want to at least do some simple screening to rule this out. And there's some online questionnaires. The SAGE is a good one, SAGE, which can be downloaded and you can take yourself at home. And we actually use in our offices as one of the screening tools of many that we use for assessing patients with dementia. And you can get a sense, it differentiates normal aging from early stages of Alzheimer's or dementia. There's a cutoff score. And one of the things, too, to think about when you are beginning to have memory problems or someone complains of memory problems, and memory problems can happen from young age. There could be 15-year-olds with memory issues up to, end of life memory issues. How do you know what it is? One of the things to keep in mind is so you may be, I have 3 kids. I'll come home. I'll throw my keys down. They're running to give me a hug. Oh, Dad, look at this. This is what I did at school today. What do you want for dinner? It's like, oh, where are my keys? What?
Right. Yeah.
And that's more of an attention issue than a true memory issue because I didn't focus on where I put the keys down and remember. I just kind of absentmindedly toss them somewhere, and then I'm not going to run out and think. And that's more of an attentional issue, and there can be, quote, memory problems from that, but it's more what we call working memory, which is super short term. It's just what you're focused on in the moment. You go to the next room. Oh, what did I come into this room for? And you have to retrace your steps. And if you're able, if occasionally that's normal, that's absolutely normal. If it takes a really long time to remember, more than a couple of minutes, or you never, or if there's people that you've known for a long time that you forget their names, and also word finding difficulties. That's one early sign where if you're describing something in conversation, you just can't quite pull up the word for that thing. You keep calling it that thing or trying to describe it without using the word, and it's a simple word. Then that's the key. And the thing is too, if it's different for you, if there's a change for you out of normal, that's also a key, and we call that subjective cognitive impairment versus objective cognitive impairment, where it may not show up on testing, but for you it's not normal. And I would still get that checked out to see if it's something to be more concerned about, and a more thorough workup needs to be done. Really one of the leaders in this whole area that has given us a lot of hope that we don't have to, that there's a new approach, is Dr. Dale Bredesen, who's a neurologist out of UCLA, and he talks about subjective cognitive impairment having 5 to 10 years to make significant changes before it's too late. And so there's time to act. So we can talk about him if you'd like to.
Yeah, I've read some of his research and his popular books. And one of the things that was really interesting, maybe we can just touch upon briefly, is he thinks, sort of this assessment and screening for brain health should happen much earlier than we do.
Yeah.
So,
exactly.
For example, I think he has like a series of tests that you might consider when you're looking at your own brain health, almost like you would if you were doing like a preventative colonoscopy when you turn 50. So can we just jump into a little bit about some of the preventive tests that you are familiar with and that you feel strongly about?
That's what I love to do, and we connected with Dale about 4 or 5 years ago after one of his first studies came out, because he's a researcher, he needs clinicians, and so there's a bunch of clinicians that went and did training to learn from him. And this will help answer the question about what labs to do or what to look for, is that we want to, it all comes down to one thing when it comes to neurodegenerative changes, and especially Alzheimer's disease, is this APP gene or enzyme, amyloid precursor protein. And it's like a molecular switch that flips on or flips off, and if it flips on, it signals programmatic cell death and neurodegenerative changes, bad. If it switches off, there's more neuronal cell growth and development. Just like other parts of the body, we have osteoblasts, which build up bone, and osteoclasts, which break down bone. So these different processes in the body to build up or break down. So in the brain, it just makes so much sense to me when I thought this was huge when I learned about this. And what affects that APP gene is all of the things that we talk about in naturopathic medicine. If you eat a poor diet, if you don't exercise enough, if you're deficient in nutrients, hormones, if you have exposure to toxins, especially mold, or heavy metals, or infections like Epstein-Barr virus, and there's certain viruses associated with Alzheimer's now. And he talks about looking at all the different risk factors together and identifying them. And so that's why he talks about a barn roof with 36 holes in it, and we want to identify as many of those as possible and patch them and tip the scales in the right direction. And so that's where that's what we do here, is a very thorough workup. We do the psychological testing, but also we do a really thorough lab workup to look for inflammation, deficiency. So like HSCRP, we look for nutrient deficiencies, vitamin D, zinc, copper, iron. We look for toxicity. We always screen for mold. It's just, in a number of patients and cases, mold is actually a significant factor in memory, and when we clean that up, memory begins to improve. And so what's the key is it's not necessarily it's mold instead of Alzheimer's or Lyme disease instead of. It's like that's what's triggered the APP gene to signal programmatic cell death, and it's triggered Alzheimer's. So it's like we're trying to remove as many triggers as possible. And it's very affirming for me as the kind of medicine that we do, to look for treating the cause, to fully change your diet and your doing exercise if you haven't been, and reducing stress. That's a really significant piece. So it's like you kind of got to do it all to get the best chance of improving your memory and staving off. Not that you can reverse Alzheimer's or dementia. You cannot get rid of it, but you can slow it down. This is the real hope. You can slow it down to the point where you're not progressing, and maybe even improve symptoms. And that's the very first goal. And isn't that a much better, more hopeful story than the first one we talked about, where it's like, okay, take Aricept, we'll see you in 6 months, hope it doesn't get worse. There's not a lot we can do.
Great. Excellent information. Thank you. With the APP gene, is there other genetic mutations or potentially like single nucleotide polymorphisms that you factor in looking at if this gene is turned up?
Man, that's a great question. I think that's $1 million question, like if we could actually look at that closer. The one gene that we all should be thinking about and knowing about is the ApoE4 allele. And it's, I used to think, oh, you're going to get Alzheimer's if you have it. And that's not necessarily the case. You can have 2 copies, 1 copy, or no copies. And it's more than just, it's really what it is. It's an inflammatory marker. And it's like pouring gasoline on the fire. If you have inflammation, so someone that has prediabetes, that's bad enough as far as cognitive decline and causing inflammation to the tiny vessels in the neurons. But if you have that prediabetes plus the ApoE4 allele, it's so much worse. And so those people, essentially, with those genes, need to be more vigilant at looking at all of the risk factors, reducing inflammation in particular. But and one is worse than 2. It basically increases your chances of having Alzheimer's, but it doesn't mean you're going to have it. Like you may have heard of the nun study, where there was some nuns who didn't have Alzheimer's, but when on autopsy they had the brain of someone who had Alzheimer's. And so and they had the genes for it as well. But they didn't actually have
something about their lifestyle prevented it from expressing.
Exactly.
Interesting. So with your center at the Alman Clinic, you've always been known for advanced imaging and some of your technology. Can you just shed a little bit of light as to are you using this technology with these therapies to monitor progress, or what kind of? Can you just go into the type of imaging you're doing, maybe as it correlates with the dementia approach?
Yeah, absolutely. So it's called SPECT, Single Photon Emission Computed Tomography, and it is a type of nuclear medicine scan looking at brain function and blood flow. So it's different than an MRI that's more structural, and this is more functional, looking at activity of the brain. So it's more similar to like a PET scan. And it will, and this is not just our research, this is research done back in the 90s, that SPECT imaging can pick up changes in the brain looking like Alzheimer's 5 to 9 years before symptoms occur. So you can see an Alzheimer's or a dementia type pattern or other problems with the brain before symptoms are at the very start, to know where things are headed. And that time is so valuable. That's when you can make the biggest change. And that's where I think I want to get the message out to other naturopathic doctors or clinicians interested in natural health, because those are the ones that can really, are equipped to help people the most. And like I said, there's going to be a tidal wave of them coming out. But yeah, that's what we do, is SPECT imaging, and we can actually understand how the brain is functioning, which correlates with memory problems, focusing problems. We can detect brain injury very sensitively, and it guides our treatment and assessment approach. Yeah.
Well, that is really great. The one thing I just want to conclude with is, you've given us a lot of information to wrap our head around, no pun intended. So the the thing that I'd like to kind of conclude with is if you could just go into where people can get in touch with you, how they can follow the work you're doing. Are you doing any kind of writing or speaking? What's the best way for people who are interested in learning more from you or potentially seeing you as a patient? How would they get in touch with you?
Mm-hmm. Yeah, I mean, that's great. They can contact us here at Amen Clinics in Bellevue, and the number is 425-455-7517. Amen Clinics Northwest is our location. I'm speaking at there's a conference in San Diego, the IMMH, Integrated Medicine for Mental Health, in August, and that is going to be, I'm talking about brain injury and approaches to treating brain injury, and I actually have a book coming out on that topic next January is when it should be out, and that's geared towards patients to help understand, similar to Alzheimer's, like there's not a lot of help that's really concrete with specific supplements to take and labs to do for traumatic brain injury, even mild brain injury and concussion, like from sports.
Where will that book be available?
Hopefully major bookstores near you.
Okay.
But,
okay.
Yeah, in January. So publishers Kensington, and it's quite a ways out now. It's March only here, but
well, congratulations.
I'll let you know. Thank you so much.
Well, great.
It's been great to talk with you.
Thank you for being on One Thing. It was very interesting speaking with you. I learned a lot. I'm sure our listeners learned a lot, and it gives us some hope of potentially to get in front of progressive memory loss before it actually happens, and also some hope for some things to work on if the memory loss process has already started. So I thank you for being on today.
It was my pleasure, Adam. Always good to talk to you.
Hey, this is Dr. Adam Rennie. I'm recapping today's episode. Learned a lot on this episode. Hope you did too. The key takeaways for me about Alzheimer's and dementia is to really understand that there's a main difference between attention issues and then memory loss issues, and to really be aware of the differences between the two. And I think one of the points that Dr. Chapek made that was really outstanding is that we all have attention issues from time to time, but if there's a memory issue that is different to you or different to your observation of one of your loved ones, for example, some of the early signs of dementia and Alzheimer's would be loss of awareness as to sense of direction. So someone who is driving the same route home year after year and then suddenly gets lost on that route home. Now that would be a concerning for early signs of dementia and memory loss. So it's really good that he pointed out the difference between attention and memory loss. I really enjoyed that. That was an excellent point. Also, I think some of the avenues of testing for activity of memory loss. So he talked about the APP gene and also the ApoE4 allele, or just testing for ApoE subtype. This is something I think we all should do. We should all know what our risks are. The ApoE test is commercially available. It's in every major lab that I've seen. Also, it can be part of the panel that's offered through the 23andMe test or other ancestry DNA testing. Looking at that as also a risk factor. So I've posted a lot this week on dementia and Alzheimer's, and one thing I'd like to bring up is that there's various theories as to what's going on in various different avenues to pursue controlling neuroinflammation, which is essentially the description of the pathological or pathophysiological process that's taking place in dementia and advancing Alzheimer's disease. So there's two main components, and one is the amyloid beta component, which is sort of these plaques that are forming outside the neurons, and which are considered to be disruptive to neuronal function. And then the other component is neurofibrillary tangles formed by tau protein. This is a protein that's collecting within the neuron, disrupting its function. So we see both tau protein and amyloid beta plaques in the brains of dementia and Alzheimer's disease patients. And these are the therapeutic targets of most of the medications that are available, is to lower the amyloid beta. Now, there's been over 100 trials with different substances that are trying to lower amyloid beta, and they have all been predominantly considered unsuccessful. So there's obviously much more to the story, and so many targets are now looking at lowering the tau protein, not only the amyloid beta plaques. So this is the direction that a lot of the drug therapies are going. In naturopathic medicine, as Dr. Chapek mentioned, and he's really on the frontiers of integrative medicine, in these two circles, we're looking at different components of neuroinflammation that might be caused by viruses, molds, also due to blood sugar dysregulation. And in my world, I look a lot at some of the neuroinflammation that's being caused by the microbiome. And other aspects that are being looked at are something called glutamate toxicity, which is a neurotransmitter that may be toxic to the nervous system tissue. So these are other angles that are being approached for Alzheimer's disease and dementia. So right now, because everybody's really trying to figure out what's going on here and how to best control neuroinflammation, we're looking at many different routes to help sustain or preserve tissue. I don't think anybody knows right now if there's a cure for Alzheimer's disease or if you could even reverse it. But as Dr. Chapek so astutely pointed out, is perhaps these approaches can delay the onset of Alzheimer's disease or also slow progression. And at the very least, it gives some empowerment to the patients to work on health issues that are potentially overall going to make them feel better. One last thing I'd like to say is there's a big emphasis in the Alzheimer's world with emphasis on sleep and the discovery of this system called the glymphatic system. And we are learning that circadian rhythm, normality, and attunement to circadian rhythm is key in helping our brains recover each night, and potentially will be another major avenue of helping with slowing progression of dementia and Alzheimer's, and maybe as a primary prevention is to work on the glymphatic system, which is a nightly detoxification system that has been discovered in the brain that's mediated by glial cells. So it's an exciting area. It's very troubling to see anybody deal with dementia, Alzheimer's. It affects the caregivers on a deep level and obviously the patients on a deep level. It's considered in medicine and in healthcare as a long goodbye, and it's something that we all need to figure out how to help and prevent. Thank you for tuning in. We'll speak to you next time on One Thing.